a lot of patients don't really notice that they have cataracts, and the effects of the cataracts kind of depends on the nature of the cataract itself. So cataracts come in slightly different forms, which I won't go into here, but generally they will all have an effect in degrading the quality of the image that's presented to your retina at the back of the eye. And you can imagine the lens in the camera is a bit cloudy, that it will affect that image in such a way that you might notice it as glare or have difficulties driving at night. Other cataracts might drive a change in your glasses prescription, and that's something that might be picked up by your optometrist in the community, and that's not uncommon. Otherwise, you might notice that you're having more difficulty with reading, for example. So cataracts can affect your vision in multiple ways. Some of these cataracts actually, bearing in mind a cataract is essentially where the lens goes a bit cloudy, develop a bit of a yellowy sort of color to them. And so colors can appear less bright or maybe tinted in a slightly yellowy way. And because these changes occur over time in most patients, they're not usually aware of them until the surgery's been completed and they have a brand new lens in the eye that allows a lot more of these colors to come flooding back, and a lot of the clarity comes flooding back. So you may notice afterwards that your driving vision is a lot better and more confident with driving. So you can see that cataracts can affect your vision in a number of ways, but ultimately there's something that we can do about it, and that's the important thing. So cataracts can be genetic, but by far and away the most common cause of cataract is to do with aging. It's an age-related change in the vast majority of patients. And that's just a natural consequence of life. If you live long enough, you will get some cataract. In terms of the genetics, well, it does run in some families, but it's such a small percentage of the overall number that it's almost not worth discussing in this context. When it does run in families, it tends to occur at a younger age and be more noticeable at a younger age. And the treatments and approaches to how we tackle those differ slightly to how we would tackle majority of cataracts in the population. So I touched on this earlier. The fact of the matter is that aging affects us all eventually, and it affects the natural lens in the eye, what we call the crystalline lens, in such a way that the proteins, which are the building blocks that make us what we are, these tiny molecules, become clumped together. So they're arranged in a very careful way by the body to be transparent and to focus light. And over time, things like ultraviolet radiation can affect these proteins and damage them. And that's just a consequence of being exposed to sunlight over the course of our lives. And they begin to aggregate. And a consequence of that is that they start to scatter light as it passes through. And then if the light scatters, then the quality of the image at the back of the eye becomes affected. And we recognize that as blurring or glare or difficulties with reading and so forth. Now, as I say, most cataracts are due to aging, but there are conditions which can accelerate cataracts or other conditions that will cause cataracts. And amongst those are systemic conditions such as diabetes, or if you smoke, that can accelerate the development of cataract. And then less commonly, we see cataracts in the context of trauma or patients who've had previous surgery inside the eye. Those patients may also be at risk of cataract. And finally, that there are a category of patients that may require steroid drops to control other conditions, inflammatory conditions that affect the eye, for example. And those drops can have the effect of raising pressure in the eye, but also carry risk of cataract, particularly if it's a high potency steroid or the patient's been on steroid drops for many months or even years in some cases. So many different things can cause cataract, but by far and away the commonest cause is aging. And whilst that's not a pleasant thought, at least we're all in the same boat where that one's concerned. cataracts can certainly develop in people that have good eyesight or might be considered to have good eyesight. I suppose it is the flip side of what I've suggested regarding aging. So I might be regarded as having good eyesight, but over time that may deteriorate as I get older. Certainly, I'm getting to an age now where I may start to need reading glasses in the next few years. That's rather different to cataract. That's just because the lens is not as good at changing shape to focus light for near vision as we get older, particularly in our 40s and our 50s. That's rather different to cataract. Cataract is where the lens actually goes cloudy. And so I would say that there are two categories of patients that might undergo a cataract surgery procedure. There are those in their 40s and 50s who occasionally elect to go for a surgical procedure such as a cataract surgery procedure, even though they don't have cataract, because they're tired of having to wear reading glasses or glasses of any sort. And removing the lens, even though it doesn't have any cataract, and replacing it with a clear plastic lens is one way of tackling that problem. But as I say, eventually most of us will get to a point where we find that the effects of aging on the lens or other factors that impact on the quality of the lens and the clarity of the image it provides, most of us will get to a stage where we need cataract surgery. Really, the only treatment for cataracts, to get rid of a cataract, is surgery. Unfortunately, that's a really highly refined procedure now. If you were to go back maybe 50 years, the results of cataract surgery were just not as good as they are now. It's got to a point where the procedure is evolved to such an extent that the risks are much lower than they've ever been, and the impact of the sorts of lenses available give us much more flexibility in targeting and tailoring the outcomes for individual patients. So it's important to remember that every procedure carries risks. They're relatively small in cataract surgery, and generally the procedure is carried out as a day case procedure. So you would come into the hospital or the eye unit, and you will be given some drops, usually to dilate the pupils, which may make the vision a bit blurry temporarily. And then you have anesthetic drops put in the eye, and we have the option of then putting anesthetic in the front chamber of the eye to numb everything there, or bathing the eye in anesthetic using a slightly different method prior to conducting the surgery. And the surgery itself involves making some very small incisions in the clear part of the front of the eye, the cornea, and gaining access to the front of the eye, which is where the lens is, and removing that lens using ultrasound, so breaking it up and then aspirating it to remove it from the eye. And then, because the lens technology is so evolved now, we're able to introduce these small lenses that fold through these small incisions and into what's called the capsular bag of the lens, which is preserved during the surgery. And that lens will then focus the light for you and stays with you to the end of your days. It usually doesn't need anything more doing. But as I say, there are a few risks, and one of those is infection and bleeding. Thankfully, these are very few and far between, and I would put the figure at less than 1 in 1,000 cases. Even if something like that were to occur, there are options available to us to reduce the risk of visual loss, but that is always a possibility. And then there are always risks of complications during surgery and even after surgery that might require a longer procedure or further surgery to correct. And it's important to recognize that even if there was a complication, that can usually be corrected and you can still have a very good outcome. The risks vary from patient to patient, but on the whole, it's about 1%. And then there is a procedure that may be required to clear the vision again in a year or two after the surgery because of some clouding that occurs in the bag that holds the lens. So occasionally, patients may require a procedure that involves using a laser to just break up a membrane that thickens up and becomes more opaque over time in the eye. And that's usually low-risk procedure that can be performed in clinic. And that may occur in about 10% of cases. It may be required more frequently in those opting for what we call premium lenses to reduce their dependence on glasses. The first thing is, don't panic, because it's such a common condition. Cataract surgery is the most commonly performed operation in the world. So you're definitely not alone on this one. The second thing is that you'll want to either see an optometrist or a GP to get referred to an ophthalmologist who can assess the eye in more detail and make the investigations that are necessary prior to cataract surgery and take you through that process. That's if you're going through the NHS. If you're going to go privately, and there are some advantages to going privately, then you can contact an ophthalmologist directly or go through their personal assistant or website. So there are multiple routes into the service, depending on which route you choose. The advantages of targeting, going to your surgeon directly are that you may be able to choose your surgeon. You may be able to decide with your surgeon or what day to have the procedure or a time that's convenient to you. And finally, there may be options available in the private sector that are not available in the NHS, where the majority of cataract surgery is undertaken in the UK. And those options include lens options that may reduce your dependence on glasses. So as I mentioned earlier, there is a cohort of patients that may opt to have lens surgery much earlier in life to reduce their dependence on glasses. But cataract is no barrier to those options being made available later in life. So if we're going to do a cataract operation, we have an opportunity to reduce your dependence on glasses. We may just reduce your dependence on glasses for distance, for example, if that's a problem for you. Or we may be able to put a lens in the eye that allows light to be focused in such a way that some of that light is made available for your distance vision, some of it for your intermediate vision for computer use or using your phone, and then some for near vision. But those sorts of lenses come with extra, I wouldn't call them risks, but certainly factors to pay attention to, and do carry an increased risk maybe of needing further procedures that all need to be factored into discussions with the patient. That's really for another talk, but it's something to consider if your priority is not just to get rid of the cataract, but also to reduce your dependence on glasses.